Hello friends, welcome to Creative Medicine. In this lecture, we will learn about
Then, the first step in the management of hirsutism due to Steen-Leventhal syndrome is, first and foremost, you should give oral contraceptive pills. Oral contraceptive pills should be given in a patient with hirsutism due to Steen-Leventhal syndrome. Then, the treatment of polycystic ovarian disease drugs. The drugs used are drugs like GnRH analogs and spironolactone are used for the treatment of hirsutism in polycystic ovarian disease. Then, okay, a hirsuate lady with polycystic ovarian disease treatment of polycystic ovarian disease is ethinyl estradiol, and desogestrel is the treatment of polycystic ovarian disease. Desogestrel is a fourth generation.
thank you and thank you for watching.